Come on, y'all.
Hey, and here we go.
Welcome to the Cheer Chronicles podcast with Rosie.
Hello everyone and welcome back to the Cheer Chronicles podcast. I am your host Rosie, and today's episode we are going full out on concussions. Concussions can happen in any sport, but today we will be concentrating on the sport of cheerleading. Overall, concussion education is essential for promoting safety, early detection, proper management, and long-term brain health. And we will also be talking about changing that culture of concussions in the sport of cheerleading. We have a super important guest today, Dr. Tammy Sadighi, who is a graduate of George Washington University with her Doctor of Nursing practice. Currently, she's an associate professor at the Florida Gulf Coast University teaching pediatrics in a nurse practitioner program. She is also a nurse practitioner practicing for 15 years in the areas of family medicine and urgent care. In the urgent care role, she has extensive experience with head trauma and concussions. Along with performing sports physicals, Dr. Sadighi also educates parents on concussions and heat stroke. She has been published in many journal articles and has been invited as a speaker to state and national conferences. And today, she joins us on our next episode of the Cheer Chronicles podcast. You guys, enjoy this episode with Dr. Sadighi going full out on concussions. Hello, everyone, and welcome back to the Cheer Chronicles podcast. We are here with Dr. Tammy Sadighi. She is a professor at FGCU and a pediatric nurse practitioner, and we are going full out on this episode on concussions and the dangers of concussion, the warning signs of concussion. So we're going to get started to our very first question. Tell us a little bit about your background and experience in concussions.
I've been a nurse practitioner for about over 15 years. I was in family practice for quite some time. I went into a family practice urgent care setting, which I really enjoyed. It's like a walk-in urgent care. So we were open Saturdays and Sundays. So I saw a wide variety of different cases, not just strep throat and ear pain and things like that, but I saw a lot of pediatric issues because there's nothing really open on the weekends. And that being, a lot of that being sports physicals. So I became very good at sports physicals, and I was noticing a lot of things were missing, such as education and concussions and those kind of things. So that's what really got me interested in concussions and education on adolescent concussions.
Okay. What exactly is a concussion and how does it affect the brain?
Well, it's a biomechanical force, and it can happen with a fall. It can happen with hitting somebody else in the head or something being thrown at you. A lot of times it's mostly falls. And what it is, it's something that hits the head, not just the brain. We're talking about the skull itself. And what happens is that it has provides a functional disability, not so much a structural. So you won't really see like a indentation in your head per se, but it's a functional problem, and it manifests itself into a neurological symptoms. And so when we think of concussions, it's basically anything you can think of that neurologically could happen.
And not necessarily the patient might not have a bruise or anything there that may indicate that they have a concussion. It's definitely internal.
Correct. They look perfectly normal. They'll come into my office and they look perfectly normal, but they're dizzy and they're nauseated or they can't walk very well. So you're like, wow, but I can't see where that baseball hit your head or where you did anything. But it's a neurological problem.
Yeah. And I have to tell you a little story time. So my daughter, well, you know, both my daughters do cheerleading. So she was throwing her tuck one evening at practice, and she bailed out on it. So, of course, you're doing the tuck, no hands, right? And she kind of just freaked out in the middle of the air, landed on the back of her neck. and hit her head. Now, luckily, where she was practicing was the spring floors, which aren't as hard as what we were just talking about before we started recording, which is the basketball court or the concrete.
Right.
And so she hit the back of her head, and she, said she was fine. However, a few weeks later, I found out that she was not seeing clearly through one of her eyes. She said, she said, thinking back, and even though she kept saying, I'm fine, I have a little headache, she said this part of her eye was missing, like the vision, which was interesting. And I'm like, yeah, you need to let me know right away.
And they call that a curtain, and it's like a curtain's coming over their eyesight, and so that's what a lot of times they'll explain it. That's what it feels like.
Yeah. Wow. Okay. Tell me, what is the symptoms of a concussion and what that recovery time looks like? Because I know I've seen some athletes come back sooner than others. Others take a really long time to clear. So tell us the symptoms that parents need or even coaches need to be looking for, and then that return to play time.
Well, there's three types of concussions. We have what they call grade 1, grade 2, grade 3. Grade 1 we call a mild concussion. And in a mild concussion, the student or the athlete will mostly complain of maybe nausea, a little memory loss, could be maybe a little bit dizzy. They have one thing that I've noticed is they'll just have a light sensitivity or noise sensitivity. Some even have a smell sensitivity, believe it or not.
Really?
They think everything smells different.
Wow.
And after their practice and they fell and hit their head, they'll say, no, I don't want McDonald's, or I don't want that. It doesn't smell good to me. So that's could be a sign of a mild concussion. So nausea and a headache. And the headache's not real bad. It's more of a mild headache for a grade 1 concussion. Grade 1 concussions, even though you don't go to the hospital, we still say you need to see a provider within a day or two. One of the concerns that I do have with mild 1 concussions is even though they're mild 1, they can develop very quickly into a grade 2, which is a moderate concussion. So the first 24 hours is very important that parents need to watch their child after a mild concussion symptoms for excess sleepiness or any of those symptoms I just talked about getting worse, then they would need to be seen in the emergency room. But just make sure you watch them for the first 24 hours. My son had a mild 1 or grade 1 concussion, and he did get worse throughout the night. They were pretty mild, and then I woke him up at 2 and he didn't know where he was at.
Oh, wow.
So it progresses. So you do have to really watch him within the first 24 hours. Grade 2, or what we call moderate concussions, the symptoms a little bit worse. So now you just don't have nausea. Now you have vomiting and you get confusion. And those are the two big ones. And a lot of times they can get almost like not sleepy. They get more sleeplessness. So those are the grade 2. Grade 3, or what we call severe concussions, we call those the red flag symptoms. And these symptoms, if it happens, they need to go to the emergency room immediately. One being neck pain or loss of feeling or sensation in their extremities. That could be upper or lower, because what we're worried about is cervical fracture and or cervical instability. So neck pain or any kind of loss of sensation or movement in their extremities. Other red flags would be double vision, unequal pupils, fluid coming out of the nose or the ears. I've seen that. Or bruising.
Just clear fluid?
Clear fluid, right, because we're worried about spinal fluid. And then bruising, because that can be some kind of base stem brain injury. Of course, again, we're talking these are really severe, dropping from a high, an elevated area down to a concrete, let's say. So these are the kind of symptoms you can have. Confusion, seizures, convulsions, severe headaches that are just intractable. They just so severe. Constant vomiting, being very combative, and of course not knowing where they are, or they could just be lying there motionless. So these are all your red flags. That would be something you'd want to call 911, especially for neck pain and weakness or inability to move your arms and legs. You're not going to touch that athlete. You're going to leave them there, call 911 because they're going to need a cervical collar and a back brace.
When we talk about seizures, are we saying any kind of seizures? Because mostly when people think of seizures, they think of, the uncontrollable shaking of seizures, but seizures range from different
You can
symptoms.
have, correct, yes, correct. And it can be a blank seizure where you're just looking at them and they don't know you're there.
Like nothing's happening.
It's a blank stare, and that's a red flag. But it's kind of, usually the grade 3, the severe concussion symptoms is very obvious. Grade 1 and grade 2 are a little bit blurry. I would say the biggest one is there's memory loss in grade 1 and confusion in 2.
And
they
that's
don't know
the
where they're at.
Okay.
Right.
Wow. Okay. And the recovery time for concussions obviously depends on the grade.
It depends on the grade, but not only that, it depends on the grade, and it depends on how well the student or the athlete takes care of themselves afterwards. You're not supposed to be doing anything really active after a concussion. So anyone that has a head injury needs to be removed from the practice or the play, whatever it is. They should not do that until they're seen by a specialist, a provider, not a specialist, a provider, and be able to be told when they can come back. Most concussions take 7 days to resolve. And the highest rate of a repeat concussion, which is, we call that a second impact concussion or second impact syndrome, is in with the first 7 to 10 days.
Okay.
So that's when you really have to be careful. I always, when I give permission for cheerleaders or athletes to go back to practice, I really err on the side of caution, and I do 10 days.
Okay. Okay, so 10 days. What is the typical testing for a concussion when you have an athlete come in and they tell you, this occurred to me, I had these symptoms, what is the next step?
Well, we ask them how they fell, and we want to know how far up they fell, what the distance was and what they landed on. Those are good questions to ask. But we have something we call the SCAT test, and it's called a Screening Concussion Assessment Test, SCAT. And what it does is we look at the observable signs. We watch them walk into the room to see if they have balance issues. We want to see if they look like they're leaning to one side more than the other. So these are what we call observable symptoms. And then we do what we call the Maddox training or Maddox interviewing. And we'll ask them things like, so do you remember what inning you were in when this happened? Do you remember if your team was winning at the time? So these are like athletic questions we would ask. So we would ask cheerleaders, what inning were you in? Do you remember what your last cheer was? So these are things that we're looking for cognitive, more like cognitive questions. And then what we do is we do a cervical screening to make sure they can move their arms and their legs, of course, that's all stable. And then we'll do what we call a Coma-Glasgow scale, which will make sure that usually if they're in the office talking or in the emergency room, we know they're not in a coma. But we still do. It's more of an eye, a verbal, and a motor assessment. And then we do a cognitive one. Do you know who you are? What's your birth date? What year were you born? What were you doing when you fell? So these are the kind of things that a provider will do in the emergency room or a walk-in clinic. Again, you wouldn't be in a walk-in clinic if you have the red flag symptoms of a
severe
grade 3.
Yeah. Okay, so let's talk about how do medical professionals, again, diagnose concussions once you have determined, again, you went over the symptoms, you did your assessment, now you've determined, okay, this is, what is the next step after that?
Well, the gold, I call it the gold diagnosis of concussion is, it's great, we can interview, we can use the SCAT, we can do all of that. But really, it's the CAT scan of the head. That's the gold standard.
It is the gold standard for a lot of things.
Right, exactly. and it used to be, if you hit your head, you bought yourself a CAT scan of the head. It was just automatic, a CAT scan. But now we're trying to cut back on that because we're dealing with adolescents, and CAT scans come with radiation.
Yeah.
So we're not jumping straight to CAT scans unless they're showing pretty much moderate to severe symptoms. Used to be everyone got one, but that's not the way it is now. We've tried to cut back on that.
Is it an automatic CAT scan if the athlete has a history of a a a bleeding disorder or
Correct.
yeah. Okay, so that is for sure.
Because if they fall and they have Wildenbrand's or something like that, where they have a bleeding disorder, maybe if they're on, I wouldn't know why would they really be on aspirin daily,
Right.
but any kind of blood thinner, we would definitely do a CAT scan, even if for a mild concussion. Absolutely.
Okay.
And I will tell you this real quick: if you've had concussions recently and you fall again, you'll get a CAT scan the second time around because of that second impact syndrome.
Right. Does it have to be, let's say I fell, got a concussion, came back maybe 3 months later? Does that buy you a CAT scan? Definitely. Okay.
And now the new guideline is if you have 3 concussions in 1 year, they really don't want you to play any kind of sports or cheerleading anymore.
Forever?
So, 3
wow.
concussions in 1 year.
So you're out.
You won't get a sports physical signed by anybody.
That's interesting. Okay, so how and we just talked about this, but how dangerous can multiple concussions be? As we're leading into this question, tell us about that second.
The second impact syndrome is very serious. And like I said, a lot of times if it happens between 7 to 10 days from your first concussion, this can put you out. I've seen it up to 5 years. And I was telling you earlier about a patient of mine that I have a practice, and she came in to get her sports physical done, and she completed like she does every year. And I completed her sports physical. I did her concussion education that I always do with every athlete. And sure enough, she gets a concussion. I keep her out for weeks. She goes back and gets another concussion. So we call that, again, second impact syndrome. Her symptoms after that second impact syndrome lasted 5 years. And that included headaches. It included dizziness at times, especially if she was standing up and you'd bend over. And when she would come back up from doing cheers, she would get dizzy and a little disoriented. But the headaches, the dizziness can last. And sometimes people still have mobility problems with walking and keeping straight after a second impact syndrome. But hers lasted 5 years. Actually, she was 23. She was cheering in college, and she actually one day realized that her symptoms had resolved because she just was so used to being dizzy all the time or having intermittent headaches. She finally noticed it was exactly almost 5 years from that second impact syndrome. Yeah. So that's interesting.
Yeah. So safety first for sure. Does the child, the age, gender, previous history of concussion matter? Are older athletes, do they take longer to recover? Have you noticed, what's the trend there?
Well, the one thing with concussions is that they affect your social and your emotional feelings. And I've noticed in the older athletes and cheerleaders, obviously as you go through high school, your social and emotional feelings become very temperamental and difficult. So it exaggerates. So the older you are, the concussion exaggerates that part of your psyche, I guess. So you tend not to communicate as well. You don't make friends as well. And you get angry more quickly. And I do see this in the older athletes than I do in the younger ones. So it does affect those kind of things, social and emotional things with athletes.
Well, that's good to know. I didn't think of that ever. Okay, how late can the symptoms appear? So let's say I have a concussion and might be grade 1, or maybe I went to the doctor and they were like, you're okay, you could return. But should I be watching, if I'm an athlete, should someone be watching me 3 weeks out, a month out? Can this still appear?
Well, you will have problems. If you're going to have problems, it appears usually in the first 3 days if you're going to have problems. Even if it's, anytime you get a head injury, usually the headache is automatic. It comes with it. And then when you're looking at inflammation, this is really an inflammatory process when you get hit in the head. So you're going to have a little swelling. And so swelling starts slowly and builds up. So as the days go by, the swelling can start affecting you more. So usually up to 3 days, you can see symptoms.
Okay. Well, that's good to know. Okay. So how concussion management? Again, we know that you have it now. What are the treatments? Is there any medication that they should be taking? Sometimes I know that they're obviously not doing the sport, but is there things at home that we need to be managing?
Right. Well, well, first of all, you don't want them to be vomiting because that's going to cause more pressure in the head. So we do provide Zofran if they are vomiting in a walk-in center or an emergency room, because you don't want more pressure in the head. Tylenol, obviously, for the headache. We do recommend rest. I mean, obviously they can, walk around, they can go to school if they can tolerate it. But again, we don't want them doing any kind of, jumping up and down, jump rope or basketball or, doing
so no PE
swimming,
either?
no PE. I always give them a PE excuse to stay out for, 7 to 10 days.
Okay.
Right. And especially if their PE is something like where they can get hit with a ball or something like that.
Like if they're playing kickball.
That
would be bad.
Yeah. You don't want to hit the head, right?
Don't do that.
Stay away from any injury with the head after a concussion, no climbing ladders either.
Immediate things as a coach, and the truth is that as a coach, where I coach, we go through concussion training, heat stroke, which we were also talking about, which could be a whole other podcast episode.
Right.
But also they have the athletes go through those videos as well for our middle school and older ones. So to get cleared athletically, at least where my kids go to school and where I coach, the athletes also have to go through those videos knowing what signs, and then at the end of every video, there's a test that you have to complete. To make sure you watched it.
Right.
So, but as coaches, so many parents volunteer to coach different sports. What would you recommend for us to, as soon as it happens, again, I've had athletes fall and hit their head before from a stunt. I immediately, just because I have the background, go into doing an entire neural check on them. But if I'm just, I volunteer coach, what should I be doing? What would you recommend?
Well, first of all, when they're on the ground, I tell them to stay there.
Right.
Don't get back up. Stay right where you are. Don't move. Do you have neck pain? That's the first thing I ask them. Do they have neck pain? I'm assessing now their cognitive because I'm asking if they have neck pain. So if they understand me, they go yes or no. Hopefully the answer is no.
Right.
Then I ask them, can they feel their hands and legs and feet? And they say yes. And I say, can you move them? Don't move your neck, but move. And they move their hands and knees. And then I make sure there's no fluid coming out anywhere, that they're able to blink. Can you see me? Because that assesses for grade 3 or moderate or severe concussion. So if that all passes, then I can let them set up. So I know they have neck stability, they're not having any problem. Then I set them up and see if they feel good sitting up, they're not dizzy, not going to pass out on me, and then we get them to the standing position. So it's kind of like going through stages slowly. But what you're doing is you're ruling out the worst possible thing, which would be a cervical neck instability. That is the worst thing that could happen, and we hope nobody ever has that. But once we rule that out, then we can kind of get them up and start moving them. And then doing more neural checks. How's your head? Are you nauseated? Things like that.
Your vision.
Yeah. Are you double vision? Can you see?
Okay.
Yeah.
All good things to know. Because sometimes I wonder.
Like, neck is number one. Neck is number one. And you don't want to move anyone, because if you do, then you can make the neck fracture or whatever they're having wrong with their neck, you can make it worse. So that definitely is your number one question you should always ask, and make them sit still until you assess all that.
Yeah. Let's talk about prolonged symptoms that may lead to risk factors when it comes to concussions. So let's say an athlete has had 3 concussions, and I've seen them go right back to the sport and complete the season. But again, those prolonged symptoms are going to be the headaches,
Dizziness.
the dizziness, yeah.
Headaches and dizziness are the ones that most people complain about being long-term. Again, it's not that you can't play after 3 concussions. It's getting someone to approve your sports physical. If you tell someone you've had 3 concussions, I mean, you have to tell the provider, this is my 3rd one. And usually the provider won't do it after 3. But you will find some people that will do it after 3. It's, but as far as the risk factors, the more concussions you have, the worse it is. And you think about Muhammad Ali and a lot of the boxers that get hit in the head so many times. And these are multiple concussions. And they found out the more concussions you have, the more it leads to Parkinson's and Alzheimer's. So even as a parent, you really don't, the less concussions your kids get, the better, obviously, right? So that's another reason you don't want to continue to put yourself in a position of, experiencing concussions if you don't have to. So that's why they're kind of looking at 3 being the fancy number. As far as long-term risk, they find that people have more long-term symptoms that have a history of headaches before they got concussions. So migraines as a teenager, they're more apt to have longer symptoms of concussions. So migraines, and the more concussions you have, the more long-term symptoms you have. So after your third concussion, your symptoms are going to last longer than someone who just had their first one. So those are the 2 risk factors.
Wow. Okay.
And believe it or not, girls have concussions more than boys, and I'm not really sure why. I don't know, but the research shows girls have concussions more than boys.
Any sport.
Yeah, in any sport.
That's interesting. I wonder why.
And by the way, just to let you know, in cheerleading, the problems that you have is concussions is number 1, sprains are number 2, strains are number 3, and back problems are number 4.
Well,
concussion is the number 1.
Yeah, I could tell you that I have been to chiropractors who have told me that I have arthritis in my back. And they have, well, one, I'm getting older, but also they say it's due to cheer.
Right.
And
It's cheering.
all the falls.
and you also think about the jumping that you do, and
that's hard on the joints.
You got pads between your vertebra, and so those pads just get squished, so you end up with arthritis. So that's what
we might need
problems.
to just wrap our kids in bubble wrap and call it a day.
Yeah, but cheering's fun.
Yeah, it is. So during the return to practice process, what is that like? What are the guidelines? Again, I feel like some athletes are super frustrated that, hey, I'm not going to return in time. I've seen some that return quicker. I've seen some come to practice and wear like a helmet to protect themselves. So let's talk about that process of, when you feel comfortable letting the athlete come back to play.
Well, when they come back into my office and they want to go back in the course, it's hard for an athlete not to get to go back to play. That's their life at that time. That's how they relate to their friends. That's their social group. It's very hard. So a lot of begging goes on. So so one of the things that I have an issue with is sometimes they won't tell the whole story when I ask them, how are you doing? Having headaches? No.
That's my fear.
And they're holding their head going, and they're still having symptoms, but verbally they won't tell you
That's the fear with, I feel, any patient is, you got to be honest with me here.
Right. And that's what I tell them. I said, you have to be honest, because if you get that second impact syndrome, you're going to be out longer. So it's better to tell me the truth and tell me your symptoms and what you're really feeling and stay out 2 weeks than it is to go back and get a second impact syndrome, and you're going to be out years. You may never return again. So then I get the right answers, and then they'll say, "Well, I'm still having a little bit of a headache, and I'm still a little nauseated." And I go, "Then let's sit out another week." So we usually do it week by week.
Okay.
So not month, because maybe they're better in another week. So then I don't want to keep them out a month if they're better. So I try to have them to come in every week, and we just reassess after 10 days. And then if they're feeling good, then I've got to go by their word, and then I can give them the okay to go back.
Do you, and I know every sport is different, when they do go back, do you have limitations to that? Like you could go back and maybe do jumps, especially in the all-star world, we're going to have a routine, right? So that routine will have jumps, it'll have a dance, it'll have stunting going on. Do you release them in parts? Like you could go back and do, because I know with sprains and things, you go back and do jumps and maybe just the dancing part, but definitely not stunting or tumbling.
Sometimes I have them go back and just be a spotter.
Oh.
Start off just, still part of the team. You're still have your uniform on. You're still in the environment of participating or being part of the team. But let's start off as being a spotter. Especially someone that does the high jumps, I call them, because, I don't know all the technical terms. when the girl came in and said I was doing a double down when she hit herself the last time, I'm like, a double down? What's a double down? So sometimes we'll just start as spotters, without any jumping, and then see how that goes. Okay. And then another week they're still doing fine, then we can move, we can progress up. Yeah. Okay. So that's exactly what we would do.
What are the unique challenges that you may have encountered with diagnosing, again, and we just spoke about the athletes being super truthful, but in terms of cheer or anything unique that you've encountered, like, hey, I didn't think of this, or maybe some sort of unicorn that you haven't seen before when it comes to diagnosing concussions?
Well, one of the things I will say is, cheerleaders are athletic, and so to fall, it really doesn't happen as much as you think it does. Because now these stunts are, I watch the cheerleading competitions, and I'm like, oh my gosh, they got 5 people on top of each other, and that's just unbelievable. But they don't fall. So it's not like every time you cheer and you do a jump, you fall. So I think one of the things that I think about is that when I see athletes in my office that have fallen, it's amazing. A lot of times they didn't feel good before they went to cheer that day. They had mono, which they shouldn't have been cheering because you're going to worry about ruptured spleen when you have mono. So mono's a big one you shouldn't be cheering. And you have that, but they had a sore throat. They didn't want to tell their mom because they didn't want to miss practice. So I've noticed that when I do see the accidents, it's because something else was going on. They were starting to get a virus. They had a little cough that morning. So they weren't feeling their best. So that, if you want to say unicorn, I noticed. So as a coach or a mom, if your child's not feeling good, I wouldn't send them to practice and have them doing jumps and things like that and stunts. Yeah. Because that affects their balance. Right. And they're going to fall. So that's what I would say.
Yeah, that's good. I never thought of that, even as a coach. Even as
so if
also
they're not
a nurse practitioner.
If they're not feeling good, I've noticed, because they always, I said, well, what happened before? Well, I really wasn't feeling well that morning, and I noticed my ears, I had allergies, and that's a big one, because when you have allergies, it causes pressure in your sinuses and affects your balance. And a lot of times I'll say, well, I started having sinus symptoms that morning. Then when I was doing these jumps and I was doing these stunts, I just fell off balance. So we could prevent a lot of concussions if we didn't have the students or the athletes practicing or doing their cheers that day. Okay. And actually, interesting statistic, 91% of the concussions happen during practice and not actually at the games. Really? 91%. So happen during practice, but not at the actual games, at practice.
That is interesting.
And they don't want to miss it because they're not feeling good. So anyway, that's just something I've noticed. So it's a little pearl, I guess.
And with cheer too, especially for example, we're going into a week at my daughter's all-star gym where we're going out of town next weekend for a competition. So they make those practices mandatory. You have to be there. And again, cheer is kind of unique because we don't have someone that we could pull from the bench to come and fill in for you. Right. So I can see the pressure from the athlete. Even though I don't feel good, I'm still going to show up to practice. Exactly. Yeah. So that's good to know.
And that is a problem with cheerleading. It's, like you said, there's no one sitting on the bench. There's no alternates like you do in football, basketball, or anything like that.
Yeah, for them to be able to say, well, I'm not feeling well. Let's have someone else do your spot today. We're not able to do that. Yeah, it's a lot of pressure all around.
It is. And it puts pressure on the parents.
Oh, for sure. Big time pressure. It's so important to, and I had a whole episode on commitment. but how far do we take the commitment if we're not feeling well and we're not going to be 100% and then end up with some sort of injury because of it. Yeah. Okay. So let's go into something that we call the Sendoff Round. So this
Let's
is
see how well I do.
So when we have the Sendoff Round, our guest doesn't know what we're going to ask. And it could be quick answers.
Sure.
So of course this episode is all about concussion. So our first question is, what sport have you seen the most concussions from?
I'm going to say cheerleading.
Really?
Yeah.
Not football.
Because when I'm in walk-in, I've got all the high schools around me. I've got all the Naples. I'm in the middle. I'm in Bonita Springs, so I get all of Fort Myers. I'm open on Saturdays and nighttime. So you're talking about cheerleading in the evening, so I'm open till 8:00 at night, my clinic. So I get all of those. So I don't see much of football, but I think it's because they have helmets.
Probably. Even soccer though.
Nope. No. What I see in soccer is leg wound, knee issues, and twisted ankles in soccer.
Wow.
All leg issues. Cheer.
I bet people are going to write in and say, where is your clinic?
Lacrosse is another one, I have to say. Lacrosse would probably be second because they get hit in the head with the sticks. So I would say cheerleading's number one and lacrosse is my second one.
Okay. Okay, second question. Does it help for the athlete to have a diary workout after they've been cleared for a concussion? Do you all think that's important?
I think it's important, but it's not a guideline. We don't do it right now, but it's probably good, because maybe when the athlete comes in my office and I ask them about their symptoms, they would maybe have it there for me instead of saying, no, I'm not having these symptoms anymore.
But as a parent, if my child has a concussion, even after they're cleared, maybe just keeping
a diary
of, hey, today I felt okay, or hey, today I had a little bit of a headache.
Right. And it is interesting, I didn't mention this, that even with concussions, they can have good days and bad days.
Yeah.
So you can have good days and bad days. So it's not a bad idea. We do that with headaches. Headache journals. So diaries.
Okay, next one. Loss of consciousness. What's the percentage of folks actually?
We see more grade 1 and grade 2. We really don't see a lot of grade 3. I mean, very seldom. I mean, it has to be a pretty bad hit. To have a grade 3 severe concussion.
Not too long ago, there was a big competition going on out, not here in Florida, and but they put them on TV, and so you hear about some of the injuries. And one girl was doing a kick full down, and she kicked her base in the face, and they mentioned and reported that he got completely knocked out. So that is definitely, I guess, again, a unicorn. You don't see it a lot, but it could happen, Right.
I think the more severe concussions are, again, when it happens from higher up, an elevated fall, a highly elevated fall, and falling on concrete, and also getting kicked in the head backwards, and I would say landing on the back of your head is when you see more of the severe concussions.
Okay. Again, non-compliant athletes, we talked about that. What has been the craziest kind of excuse that you've gotten about, I want to go back to play?
Well, none of the most crazy, I couldn't say a crazy excuse, but most of them are, a big one was a homecoming. That's a big thing. And in high school, she wanted to cheer for the homecoming game, and she had a moderate concussion, but she was also up for homecoming queen. And so she wanted to cheer so she could go out with her uniform, and we had to get the coach, we had to get everyone, and so that she could wear her uniform, just go out on the field as the homecoming queen, but not cheer. So we had to kind of have to make up amends for that, because you're not supposed to be in your uniform. Now, this was about 10 years ago. I don't know, it may have changed, but you were not allowed to be in uniform unless you were cheering. You can't just walk around in your uniform.
Yeah. Well, so now you can. You can walk around in your uniform, obviously you're just sitting out, but you're
Right.
still showing up to practices,
Right.
still doing all of that.
But they didn't want her to walk on the homecoming field in her cheer if she wasn't cheering, because she was supposed to be excused from cheering. She
Right.
wasn't supposed to be anywhere near it. So we had to get a special permission from a lot of people that you would think that.
Do you have to do that often and talk to the coaches and talk to the principals about?
I've talked to principals. I've talked to PE, because you have to excuse them from PE, and the PE teacher gets very upset because they're being excused. So yeah, you have to talk to a lot of people. So I will send a note home with the family to give to the PE teacher to call me at the earliest convenience to discuss.
Wow, that's a lot of
Yeah.
responsibility.
Right. Yes, it is. But that's part of doing, like, even sports physicals. When I don't allow someone to play a certain sport, the coach gets very upset and they want to talk to me. Yeah. And of course, then I have to get permission from the family to be able to talk to somebody because of HIPAA.
Right, of course.
Right.
Where is your clinic?
It's in Bonita Springs.
Okay.
It's a part of Millennium Physician Group.
And until what time are you guys open?
We're open to 6, but a lot of time there's a large influx at the end of the day, so we stay until we see everybody. But it's Saturdays and Sundays we're open also.
Oh, that's awesome.
And all the Millennium Urgent Cares are open. The one on Metros, one in Cape Coral, Bonita. The one in Naples is not open anymore, but those are the 4 big ones.
And of course, if you have any
3
symptoms, you could go there. But you
Sure.
also do sports physicals.
Yes, all the urgent cares do sports physicals.
Awesome. Well,
and they're reasonably priced too, believe it or not.
Yeah.
A lot of people think sports physicals are going to be the same as like a medical visit, but they're not.
It's less.
Because you can get a sports physical from your pediatrician, but sometimes it's hard to get into your pediatrician. So it's an easy way to just pop in and get it done on a Saturday or Sunday.
I have a question that's not related to concussions.
Okay.
Just because I'm curious.
Okay.
So if you have an athlete who is coming in for a physical and they've had a heart murmur, or do you guys ever think, hey, we need to get an echo or we need to get an EKG before you go back? Is that standard?
It's standard. If you have a murmur, the standard things for we will not sign a sports physical for is if you've ever passed out or become unconscious during exercise, not just what your sport is, but exercise in general, or we hear a murmur. Both of those have to have a cardiology referral, and the cardiologist then has to approve your sports physical.
If you have a history of a murmur and it's cleared out now, do you still need that?
No. Then
Okay.
you're okay.
Okay, that's good to know. In terms of liability, because I know that people, like you said, coaches get upset, athletes get upset. Explain the liability as a medical provider if you sign that concussion release too early.
It's a problem.
Yeah, big time.
So that's why we err on the
It's
side
your
of
bread
caution.
and butter.
Right, and
Yeah.
then that's why I can only go by what the athlete tells me, and I have to quote what they tell me. But I also say to them, this is really important, and I go back to that second impact syndrome a lot, not to scare them, but to let the athlete know, and the parent too, because they're still under their parent, they're still under the guardianship of their parent, that this is so important that we make sure they don't go back. I will tell you that the sport that I have the most trouble with, believe it or not, is tennis and golf. Because everyone thinks their child's going to be the next Andre Agassi and Tiger Woods. So they miss a game. Oh, my word.
Yeah.
Tennis and golf. Those are the 2 sports I have trouble with. The rest of them I really don't. The parents are pretty good about going, no, we need to be safe. We need to be safe. But tennis and golf, I don't know what it is, but you don't understand, he's got to play the golf tournament because he's got to win because he won't advance to the next, the next
I have no
tournament.
idea what all of that entails for golf.
So tennis and golf are my 2 tough ones. So always ask the student they come in for a sports physical, what sport do you play, obviously. So that's kind of how I know what sports are my difficult ones. It seems that's just the history I've seen.
Wow.
Since I've been doing this.
That's good information. Thank you so much
Can
for
I say
today.
one more thing?
Yes, of course.
So I would like to see, I teach health policy at FGCU, so I'm very big into health policy, and I always think to myself, what could we do better? and monitoring sports. And I always thought with cheerleading is that we should, and I was very happy to hear about you all have an education video, because when we do sports physical, it's not required. So I do heat stroke and concussions for every person.
Right.
And what would you do if you had these symptoms, right? To the parents. Most parents are at their kids' games, right? So they would know what I taught them. But we really need stunt regulations. We really don't have anything for stunt regulations. I think spotters are super important. And I think that before they learn to do a stunt, they should be educated on how to do it, and they should never do it without the coach being there. But the last one is, I don't know why they don't have athletic trainers out there for cheerleading. If you notice, there's athletic trainers. Somebody on the basketball team falls down or whatever, and there's always an athletic trainer that runs out immediately. But a cheerleader can fall, and athletic trainer doesn't get out of their seat. Have you ever noticed that? So I'm always thinking that athletic, and even in the college realm, and with universities, I notice the same thing. They really don't address the injuries with cheerleaders. So I really think these are some of the things that would help reduce these kind of injuries in cheerleading.
Yeah, and to that point, I think it all goes back to people don't think cheer is a sport.
Yeah, and that's another one. It's not really considered a sport. That is true. So you're not looked at as the other sports.
Right. So I don't need to be out here as an athletic trainer because you're not a sport.
Right.
Luckily for us at the school where I coach, our athletic trainer, we have our own little cheer facility in the back of the school. And a few years ago, I made sure that, we had an AED out there because we got to cross a whole parking lot to get onto the main campus. So that was something that I wanted to make sure we had close by, God forbid, if something occurred. And we do have the athletic trainer there after school. She is not there at our practices, and we don't have any competitions really at the school. But yeah, that's important because a few years ago, I took our varsity team up to a cheer camp at USF, and unfortunately there was an athlete from another school who had a knee injury in the middle of their stunt, came down on her knee, her kneecap was like to one side. And so it took a long time to get not only just the athletic trainer out there, but also EMS once they got there. And of course, it is a big campus and whatnot, but I was pretty grateful that I was out there. So yeah, I have to say that it goes back to...
It's not a sport.
It's not a sport.
But if you ask a high school principal how many sports you have, they'll tell you, they'll add in cheerleading on it, but it's just not nationally recognized as a sport.
Yeah.
But the schools themselves will say it's a sport.
Oh, for sure.
Yeah.
And they'll put up all the banners you want up there too.
Yeah, exactly. Exactly.
Yeah. Well, thank you so much for being on the podcast.
Oh, you're welcome. I enjoyed it. I really did.
Thank you we have a friend that we have a mutual friend that works with me and works with you, and that's how we got in contact with each other. And this was so helpful and good information, I feel like, because with a podcast we talk about so many fun things and but really getting into such an important subject of concussion and injuries. We also talked a little bit about, maybe doing a podcast about, eating disorders when it comes to athletes, because that's also important. But thank you again. This has been amazing.
Enjoyed it.
Yes. So FGCU professor Tammy, Dr. Tammy Sadighi, thank you again for joining us.
Yes.